Hello, I'm Dr. Robert LaLouche, a board-certified OBGYN physician with over 30 years of medical practice. Today I'd like to talk about the mucus plug. So, what do? What's an appropriate time to notice the mucus plug? When is it time to get concerned? Well, passing the mucus plug is a natural part of progressing towards delivery. And it isn't generally a call for concern. Around 36 weeks, give or take a little, but 36 to 37 is when you might notice an increase in discharge. You're going to start having some contractions. You can see our other labor about am I in labor to understand when you're having contractions. So when your whole belly gets tight for about 1 minute, give or take 30 seconds, when you start having some of those contractions, then your cervix will start to dilate a little bit, to open up. And as it opens up, some of the protective mucus that's in there, that's made by the cervix, that helps prevent an infection and protects your baby, starts to come out. And as your cervix stretches a little, it can have a little bleeding. So you might notice some blood tinge. You might also notice that after having intercourse. That's not a full period, not heavy bleeding, and you shouldn't have significant pain with that. Okay, so when you do notice that, make sure you drink some fluids, slow down a little bit, and try to time yourself, see if you're in labor or not. And you can see that other video for if you're in labor. Now, you can pass your mucus plug far earlier, and that is of concern. So we want to know about that. Now, 50% of all pregnancies have some bleeding in the first trimester, especially after intercourse. But that's something to bring up with your physician to determine if that's kind of a normal part of pregnancy or related to infection or related to some other threat. That would be something for another video. But the most important thing to remember is that some discharge, some spotting will occur around that time, and during your visits for prenatal care, your physician should give you a heads up when that's going to come. And then if you're still concerned about it, certainly give your provider a call or call your labor and delivery, and they can guide you through to determine if that's the normal process or something of concern. Now, there are other circumstances where you need to be on higher alert, like if you might believe that you had an exposure for an infection, or if you have something called a placenta previa, then any sort of bleeding episode would be a different circumstance. So this is when you have a normal pregnancy without any problems, that is a natural process that occurs around 36 to 37 weeks. Once you're 37 weeks, you're considered term, which means if you deliver, that will be okay, but the optimal time to deliver is a little bit further along, so the baby gets bigger and can maintain its temperature closer to your due date. We like between 39 and 40 weeks as an optimal time. So I hope this has allayed some of your fears and concerns about mucus plug, but always, if you're unsure if it is a normal part of the process, to discuss it with your support team. Hope you found this helpful. Thank you.